A very good morning to everyone. I'm going to present my paper on the topic Primary Open Angle Glaucoma in Type 2 Diabetes versus Non-Diabetes. My aim was to determine the proportion of primary open angle glaucoma in type 2 diabetes compared to non-diabetics. My study was an analytical cross-sectional study which was conducted from October 2020 to May 2020, which was conducted in ophthalmology department. My study included two groups, Group 1 and Group 2. Group 1 contained 163 patients with type 2 diabetes and Group 2 the same number of patients who are non-diabetes. And primary open angle glaucoma was diagnosed by characteristic cupping and atrophy of the optic disc, visual field loss, open angles and IOP more than 21 millimeters of mercury. Inclusion criteria for the diabetic group was the patients more than 40 years with type 2 diabetes mellitus who came for ophthalmology evaluation in the IOPD and irrespective of the duration of diabetes and glycemic control. And the non-diabetic group included the patients more than 40 years. Type 1 diabetes mellitus, patients having acute ocular complaints, patients with neovascular glaucoma, primary ankylosing glaucoma, history of laser treatment for diabetic retinopathy, patient with media opacity, secondary open angle glaucoma, which included uveitis, pigment dispersion syndrome, rubiosis, exfoliation syndrome, trauma, and visual field defects due to other neurological conditions like pituitary macroadenoma were excluded from my study. The tools which I used was visual acuity testing with senseless visual acuity, then anterior segment examination with slit lamp, and fundus examination with 90D lens, and gonioscopic mirror for ankle, and intraocular pressure measurement with Goldman applanation tonometer, and visual field defects were analyzed with Humphrey visual field analyzer, and IOP more than 21 millimeters of mercury was considered elevated. Statistics was done by SPSS trail version and all quantitative variables were expressed as mean and standard deviation. All qualitative variables were expressed using frequency and proportions or percentages. To compare the association of primary open angle glaucoma among diabetes and non-diabetes, chi-square test was used and the p-value less than or equal to 0.05 was considered statistically significant. The results were frequency distribution of sample according to the age, gender in diabetes and non-diabetes groups were almost comparable. And the frequency distribution of sample according to the IOP, fundus changes and visual field, you can see the more elevated IOP was seen in the diabetes group and fundus changes was also seen more in the diabetic group and visual field changes also was seen more in the diabetic group than the non-diabetic group. And the frequency distribution of primary open angle glaucoma in diabetes and non-diabetes was seen more in the diabetes. So the primary open angle glaucoma was seen more associated with diabetic population. So in the discussion part, the glaucoma is a progressive optic neuropathy which can lead to irreversible vision loss. Some similar studies like the Aditya Desai et al., which included 50 diabetes and it was a cross-sectional study, they concluded that 28% were found to have primary open angle glaucoma. And another study, Thakuria Jayandal et al., which included 1200 diabetes, which was also a cross-sectional study, concluded that prevalence of primary open angle glaucoma was 5 to 6 times higher than that as seen in the general population. And another study, VK Arora et al., concluded that the mean IOP in diabetes was 18.17 millimeters of mercury, which was seen higher than the general population. So the conclusion of my study is a significant number of type 2 diabetes were found to have primary open angle glaucoma and the proper evaluation should be done in patients with diabetes to look for primary open angle glaucoma. These are my references. Thank you.
See, diabetics definitely may have a chance of having development of glaucoma is more.
Yes.
And what's the new thing you have told? It's nothing not new. Everyone knows that you have to investigate for diabetes. Diabetic patients, you should investigate for glaucoma. Everyone knows that. Myopia, you have to know. Diabetes also, you are supposed to examine the patient.
Because we done in a South Indian population, so we have to know the prevalence of primary open angle glaucoma in diabetes population in our area.
What's the prevalence now in your area?
Mine was 29%.
How many patients you have examined?
I examined 163 patients diabetic population and 163 non-diabetic. Among 48 patients were found to have primary open angle glaucoma.
You said diabetes and primary open angle glaucoma and non-diabetic. Did these diabetic patient have retinopathy?
I excluded the retinopathy patients, sir.
Acha, you told 90 day after lens, no?
Sir?
90 day after lens you have used for all the
Yes,
patients.
sir. 90D diopter was used.
Just for, I want to know whether you know or not. What's the magnification you get with 90 day after?
We have to multiply with 1.3 magnification. 1.3.
What 1.3?
Usually we do diopter with 78 diopters, which is no correction factor is needed.
No, that
If
is,
we are using
90 diopter lens you have used. What is the magnification of the image? See, here's something, retina. You are going to get an image. What's the magnification there?
we have to multiply by 1 by
Multiply with what?
1 by 1
Why
by
do you
3
want to multiply?
because the magnification is reduced than that of the 78.
We are not using 78, but we are using 90.
Yes, sir.
So what's the magnification you are getting? You don't know.
Is it magnified or minified? That's the question.
From
90? It is?
Minified.
See, normally power of eye is 60.
Yes, sir.
Divide by 90. How much? 2 by 3.
Yes, sir.
So it's minified.
Yes,
Then how
sir.
do you get a magnified image then? You are examining.
Compared to 78D
No, you are seeing 90 diopter. How do you see that magnified image?
through the slit lamp, sir.
So it's lamp.
Yes, sir.
See, it's a known fact that the primary open angle glaucoma is much more common among diabetic than the non-diabetic. That is your study. This is known to everybody. It's a very, very old concept. Then what is new in your study?
In my area, I wanted
Okay,
to
tell me, why is it more common in diabetic? What is the reason?
because of the it can affect the microcirculation of the retina, and it
Retina?
can of the optic nerve. Optic nerve it can develop. So mainly
Thank you.
that's the
Yeah,
reason.
yeah.